Ovarian cancer is often seen as a silent killer, but there are warning signs that come early on. It's important to recognize them, as studies show that more than 70% of women often confuse the symptoms with general aging. For this video, we'll be discussing symptoms of ovarian cancer you need to watch out for, as well as various facts about the disease. Are you feeling all sorts of pain and pressure? Are you having trouble eating? What about pain and bloating? We're talking about all that and more. Hey viewers, I'm Dr. Sophia Fahl and welcome to the Lovers of Good Health channel. Before we begin, kindly use some time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Before discussing our first symptom, let's quickly go over what ovarian cancer is. Ovaries are female reproductive glands that produce eggs or ova. They are also responsible for producing the hormones, progesterone, and estrogen in women. Ovarian cancer occurs when abnormal cells in the ovary start multiplying out of control, and eventually form a malignant tumor. If ignored or left untreated, the tumor can spread out to other parts of the female body. Just like any other disease, ovarian cancer also has some early warning signs. Unfortunately, these symptoms are quite unclear and can be easily dismissed. You need to know that the ovaries are made up of 3 different types of cells, each of which can develop into a different type of tumor. Germ cell tumor. This is developed in the egg-producing cells of the ovary and is quite rare. Stromal tumor. This one developed in the hormone-producing cells of the ovaries. Epithelial tumor. This is the most common form of ovarian cancer. It develops in the outer tissue layer of the ovaries. Now that we know exactly what the concern is, it's time to get familiar with signs that can help with early ovarian cancer prognosis. By recognizing these symptoms, you may have a fighting chance at treating the disease before it advances out of control. Number 1. Persistent pressure. If you've been complaining about pain in the abdomen, pelvis, and lower back for 1 to 3 weeks, it can be a sign of ovarian cancer. But don't get scared just yet. This can be associated with several other conditions. Your best bet would be to talk to a doctor. Getting it checked out will help narrow down the possibilities. If the pain increases while your stress levels are high, this could be your problem. If your pain eases after making some changes in your diet, it can be related to a gastrointestinal disorder. It's quite hard to differentiate between the symptoms of ovarian cancer and basic health concerns. You might need to consult a specialist if you can't find relief on your own. Do you experience abdominal pain? How do you treat it? Has it gone away? Sound off in the comment section and start a conversation with our Lovers of Good Health community. Number 2. Difficulty eating. Loss of appetite is also a common symptom. Several ladies might find it difficult to eat just a small meal. Again, it's not necessarily due to ovarian cancer. This is what makes things the most difficult. But why is it necessary to keep tabs on these signs from the initial stage itself? Even with extreme advancements in medicine, there is presently no screening method for identifying ovarian cancer in women who are asymptomatic and do not have a family history of the disease. Several survivors will tell you that symptoms for ovarian cancer detection are few and far between. Women can show symptoms months before their diagnosis. Ladies need to pay attention to how long these basic symptoms last. Looking for accurate answers on common health and wellness issues. Hit that subscribe button and join our followers. Stay up to date on all our great Lovers of Good Health content. Number 3. Bathroom trouble. If you have the uncontrollable urge to urinate, as well as pain in the bladder, it can be a sign of ovarian cancer. Usually, it's simply mistaken for a urinary tract infection. If these symptoms last more than a few weeks, you should get in touch with your gynecologist immediately. Even changes in your bowel habits, specifically constipation, can be an early symptom. Did you know there are distinct causes of ovarian cancer? Let's take a quick look at some of the common aspects that might increase your risk. Hormone therapy and fertility, drugs, genetics, obesity, personal history of colon, uterine, or breast cancer, aging. You need to understand that having these risk factors doesn't necessarily mean you will develop cancer. A woman can be diagnosed with ovarian cancer without experiencing any of them. Bloating. Bloating is defined as the uncomfortable feeling of heaviness or fullness in your stomach. Women usually experience this during their monthly cycle. However, consistent bloating for more than a few weeks can be a reason for concern. Also, if this bloating is accompanied by swelling, it's a red flag. Now you may be asking, are there any other symptoms I need to watch out for? Other small signs can be things like acid reflux, weight loss, fatigue, and menstrual changes. Most of these symptoms are temporary and respond positively to basic health treatments. However, if the symptoms persist, there is a high chance of them being associated with ovarian cancer. The problems become more severe as the tumor grows. By the time you understand the need for medical attention, cancer spreads outside the ovaries, making it harder to treat effectively. We would suggest you consult your doctor if you are experiencing any new or unusual symptoms. So what are some ways to detect symptoms? You'll be surprised to learn that only about 20% of ovarian cancers are detected at an early stage of the disease. If found at the right time, 94% of the patients can live for more than 5 years after diagnosis. Let's take a look at some of the methods. Consulting a specialist. By the time you consider ovarian cancer to be a cause of your illness, the tumor has sometimes already spread. Some ovarian cancers can rapidly spread to nearby organs. Careful and timely attention to symptoms can improve the probability of early diagnosis and receiving successful treatment. It's best that you report your symptoms to your doctor right away. Pap test. Pap tests, or HPV, can be used to detect ovarian cancers at advanced stages. You should discuss the need for these exams with your healthcare professional. TVUS. This is short for transvaginal ultrasound. It's a common screening test used to detect ovarian tumors. The one problem is that it can't successfully confirm whether or not the tumor is cancerous or harmless. CA-125 blood test. Confused. This is used to measure the amount of protein CA-125 in the blood. Usually, women with ovarian cancer show high levels of CA-125. Gastrointestinal evaluation. Physical tests, such as an endoscopy or colonoscopy, can also help with ovarian cancer detection. But only to a certain extent. Don't worry, better ways for screening ovarian cancer are being looked at. Right now, these are the only known methods. All types of ovarian cancers are curable if the patient receives a diagnosis at an early stage. Some are also treatable at later stages, but your best bet is with early detection. There are several other signs you shouldn't ignore when it comes to ovarian cancer. Have you or someone in your life dealing with ovarian cancer? Let us know in the comments below. Thanks for your time. Don't forget to subscribe and like the video for more content like this one. Bye for now.